The United States death toll from COVID-19 appears to be plateauing, and at the same time, quarantine fatigue is setting in.
End the shutdown now! Hey, hey! Ho, ho!
We've been kind of stuck at about 30,000 new cases per day, and this is troubling. I think the biggest challenge facing epidemiologists and public health workers is to try and figure out how we get off the plateau.
The pathway past coronavirus relies on the ability to detect, treat, and prevent the virus. And while those three tasks might sound simple, they each come with their own set of hurdles.
So the plateau itself is kind of a mirage. What we have going on in America are some states where the virus totals are going down and down, other states where they're going up, other states where they're remaining just about in the center. I think it's a result of not taking a coordinated top-down approach to this. A lot of discretion has been left to individual states, which have then left a lot of that discretion to counties and even municipalities. This just leads to people, shopping around. If you can't get a haircut, within a 2-minute drive, you make the 5-minute drive and then you still get your haircut. The virus doesn't care though. It spreads wherever people have contact with each other. And so, a little bit more coordination would probably be very useful in getting this under control.
One of the biggest hurdles will be getting the public to willingly and properly contribute on this long road toward immunity.
I work for Costco and I'm asking this member to put on a mask because that is our company policy. So either wear the mask
And I'm not doing it because I woke up in a free country.
People don't like it when you tell them what to do. I think that's human nature in a large part. But sort of coordinated action by large groups of people is something we kind of need to get better at, and it's something that really works well against a virus like this. Our challenge is hard but not insurmountable because we have the infrastructure and the funding available to deal with this, just as a nation in total.
The detection strategy in the U.S. relies heavily on nationwide testing to identify who is sick so those people can stop the spread by isolating from the healthy. The first hurdle with widespread tests, they may not be completely accurate.
A person will actually have the virus for something like a week before you can actually get a positive test. And this is a problem because all the mathematical models that are out there suggest that people can probably spread the virus even before they have symptoms, and so possibly before you can get a positive test. The reason is that it just takes a lot of virus to be on that swab in order to get a positive.
Experts from Harvard and Yale say the United States needs about 20 million tests per day, that's a test for every American about every 2 weeks, to safely reopen the economy. But the White House says it's planning to provide tests to approximately 2% of the population per month. But widespread testing could be ineffective if Americans aren't willing to participate. That's because good detection requires effective contact tracing. This means government workers would need to gather data on every person who's had contact with COVID-19 positive individuals.
Yeah, and really well done systems of contact tracing, they'll go as high as about 100 contacts. And imagine getting 100 different people on the phone in a day and having to do that every single day for 2 or 3 weeks for every case. It takes a lot of manpower.
We were never certified. We were never out of the woods in West Africa until we traced the last contact.
In 2014, public health expert Tolbert Nyenswa was tasked with slowing the deadly spread of Ebola in Liberia. There were no vaccines or treatments available to him at the time.
I can assure you that contact tracing and testing is one of the effective tools that stop Ebola, and they can stop COVID-19.
Public health experts have said that at least 100,000 contact tracers will be needed to effectively trace the spread of COVID-19 in the U.S. That's a scale America has never attempted before.
You actually do not need epidemiologists and doctors and healthcare workers to do contact tracing. People with very solid high school education, people with college degrees. In the US, I see no excuse of saying they are not available manpower to do contact tracing. I think the will to do it is the one, but I'm excited now. I'm getting a lot of talk about contact tracing, which is an important tool that brought the outbreak under control in West Africa. We did not have vaccine. We didn't have treatments the same as COVID-19.
As Nyenswa noted, treatments for COVID-19 are still being researched.
There was a lot of desperation for new therapies, and we quickly jumped to conclusions that something will necessarily work. And until they're vigorously investigated and shown that they actually do improve outcomes, we have to be cautious with their use. The first hurdle is that, we're not entirely sure what this disease actually is.
Still in clinical trials are anticoagulation therapies, blood plasma therapies, and blood clot busting drugs. Dr. Huminpour says the pathway to finding the right treatment will also call for some public willingness to participate.
Enrollment in clinical trials is voluntary, and voluntary in the sense that when you're enrolled in a randomized clinical trial, you may not actually be getting the investigational therapy. You have to give some patients the therapy and some patients not the therapy and see if there's actually a difference or not, or quite frankly, if there's harm associated with the therapy. And so, some patients, some people may not want to be in a randomized trial because they want the existing therapies, but I would be cautious because the existing therapies that we have aren't actually proven. The best treatment, the best therapy is to prevent people from getting disease to begin with. It's even with all the resources poured into a patient who's critically ill with this condition, the outcomes are not very good. And so until we have those therapies, prevention and detection are crucial.
Experts say non-symptomatic Americans should prevent spreading COVID-19 by social distancing and wearing masks, while symptomatic people should isolate. Both, of course, require people to act cautiously and responsibly.
We can't just open up the economy to the young and the healthy, because that's only a sliver of the economy. And essentially, we need a way to make everybody able to go out, and masks are a key part of that.
Early testing suggests 1 in 5 New Yorkers has antibodies for COVID-19.
Inside the arm of every COVID-19 survivor are the antibodies that will lead us to a treatment.
Virginia has become the first local jurisdiction to release antibody test results.
Antibodies have been making headlines for weeks, but there's still a lot we don't know about them. Doctors are looking into whether antibodies can help with treatments and prevention methods.
The idea is that can we use these antibodies from those recovered patients to give them to sick patients with the disease as a way of fighting off the virus? And again, we don't know if it works. And that's one of the major issues with this disorder.
Antibody testing is really interesting. Unfortunately, I think we have a lot more questions than we have answers right now. So let's say you test positive for the antibody. Does that mean that makes you immune to this, and for how long? We don't know. Let's say that you're negative. Does that mean that you're not immune? Does that mean that you haven't been infected? No, not necessarily, because the peak of the IgG coming up, that could be later than what we expect. And as we get more of these numbers, we think that it's about 3 to 4 weeks after the infection or the exposure. Let's say we leap to the conclusion that the antibody level that is high confers immunity in somebody, so makes you immune to the virus. Okay, we inject that on you, in you, and you now are quote unquote immune. Even then, so how long does that immunity last? So there's multiple different steps and multiple questions that are still unanswered. And so the theory behind all of this, that once you have a big enough number of the population being quote unquote immune to this disease, that they cannot get reinfected. Okay. Possibly we could open up without the fear of a second surge. And so I think herd immunity, we're further away from that than I would think, because like I said, 60 to 70% of the population, of the US population, let's just say, has to be positive. And the US population, if I remember correctly, the most recent is of only about 5% is positive. So we're very far off from that.
Ultimately, a COVID-19 vaccine would be an important long-term prevention method, but experts say the White House has already created some hurdles toward that end goal.
There's a lot of bad things happening around communication on this vaccine. You have the White House using terms like Operation Warp Speed, which causes public mistrust because they think we're rushing things before they're ready. You have the pharma companies also making outrageous claims of having a vaccine in a ridiculous period of time. And we have to remember that ever since 2015, we've had a growing anti-vaccine movement in this country, and now it's gotten better organized. And there's been a big spread of misinformation about the COVID-19 vaccine. And I don't see pathway by which any of these vaccines can be shown to be safe and effective until next year. Vaccines may not replace existing approaches. We still may have to do some level of social distancing even after the vaccine is rolled out. So I like to think of the vaccine as a companion technology rather than necessarily as a replacement technology.
The uncertainty that surrounds the pathway past the coronavirus raises many challenges, but most agree that the public, you, are a vital part of the solution.
What happens if we don't have a vaccine by next year or the year after? How do we manage repeated waves of COVID-19 as a society? No one has really come up with a magic solution about that. It's hard work having to re-implement social distancing in the event that the virus returns in waves, as many people suspect.
In times of crisis, America has shown that it can come together and do some really amazing things. Think wars that we've been involved in, think major scientific discoveries, think the eradication of polio in the US. There have been a lot of times when people have come together and you've had money and political opinion and popular sentiment all driven toward the same goal. Right now, those three strands are not all lined up, and that's why we're not seeing as much progress. But opening up call centers, opening up more drive-through testing sites, these are things that are well within what I believe America as a country is capable of doing.